Hello and welcome to this talk from the Museum of Human Diseases at St George's University of London. I'm Carol Shields and I'm the museum curator. In this series of podcasts, I'm going to be sharing some of the stories from the museums and archives with you. This is a case of tuberculosis from 1850. It's from a 24-year-old man who was admitted to St George's Hospital in March of that year. He was suffering from a painful chest and swelling of the scalp. He was also coughing blood and suffering from night sweats. Tuberculosis is a bacterial infection caused by Mycobacterium tuberculosis. It spreads through the air and it mainly affects the lungs, but it can also spread throughout the body, particularly if the immune system is compromised. This is an example of severe tuberculosis from the museum. It's in the lungs, and you can see hundreds of small dots of infection scattered throughout the lungs. This is a form of TB called miliary TB. For the patient in 1850, there were no antibiotics to treat the tuberculosis infection. His treatment was saline and morphine for the pain. And he was also given porter, a type of dark malted beer. The post-mortem records give us details of his final weeks. He was coughing up mucus streaked with blood. The lump on his scalp was full of pus. His pulse was frequent and feeble. He became thinner and weaker, and his chest pain worsened. The wound on his scalp began to expose the bones of the skull below. Just after 2 months after admittance to hospital, it is recorded that he gradually sank and died in the evening. His skull remains in the museum to help tell his story, and you can see it here. And you can see that the tuberculosis infection has destroyed the bone, and at post-mortem it is described as worm-eaten with an accumulation of pus, separating it from the tissue surrounding the brain below, which remarkably appeared normal at post-mortem. Because tuberculosis was so common in the 19th century, and because there was no cure, there were many cases in St George's Hospital that were then added to the museum to help educate students about this disease and the different effects it could have on the human body. This photograph is another severe example of tuberculosis infecting the bones. This time it is the bones of the spine, and it is known as Pott's spine. We do not yet know anything about this person or what their final weeks were like, but we do know that they would likely have suffered from some form of paralysis due to damage to the spinal cord. You may think that these types of infections are not seen today in the UK, but we are still seeing cases of Pott's spine today. It is World TB Day every year, and we have the advantage today of antibiotics and vaccination, but still 1/4 of the world's population are infected by tuberculosis, and millions of people are still dying from this disease. Thank you for listening. I hope you have enjoyed hearing about the museums and archives. If you'd like to keep in touch, you can catch up with us on Instagram at SGUL Museum Archives. Thank you.